So, Ontario's top doctor is calling for the decriminalization of drugs. So, here's what the doctor says. Dr. Kieran Moore, he's calling on the province to decriminalize possession of unregulated drugs for personal use and make available safer supply. Now, I'm going to pause there. I don't know necessarily if a lot of Ontarians or Canadians writ large are in favor of decriminalizing hard drugs. Now, before I get into that, I think the reason why Dr. Moore and others are advocating for decriminalization is because there have been many deaths and hospitalizations, perhaps specifically of young people taking hard drugs that have been laced with fentanyl and other things that have caused, severe health issues as well as death. And decriminalizing drugs may actually, first of all, allow governments to approach the issue as a public health crisis instead of a law and order situation. And so it's treating the individual where they are, having public health supports, and potentially creating opportunities for a safer supply of drugs. So very similar to cannabis legalization, right? Like the government would rather you buy cannabis from them than your dealer down the street because it passes Health Canada regulations, et cetera, et cetera. So perhaps a drug decriminalization opens the door to the government being your supplier. Now, let's just think about this for example. For that argument to hold a lot of weight to me, I think there would need to be a lot of evidence and research to prove that chain of thinking to be correct, right? So if we say we're going to decriminalize hard drugs, let's just say we're decriminalizing things like cocaine, methamphetamines, things like that, we'll have to know that there's the government trying to intervene with safer supply that's not laced with fentanyl or other drugs. The only jurisdiction we really have to compare what decriminalization looks like is probably British Columbia in the trial that they're doing. So British Columbia has decriminalized the possession of small quantities of illicit drugs, including cocaine, methamphetamine, ecstasy, and opioids like heroin, fentanyl, and morphine. It aims to reduce the stigma of addiction and reframes the drug issue as a public health issue, not a criminal one. Now, it's a 3-year pilot program, first of its kind in Canada, and the idea is adults possessing less than 2.5 grams for personal use will no longer face arrest, charges, or seizure of their drugs. Instead, police will actually offer individuals information on health and social supports. Now, this is interesting. The idea that the police will be a vehicle for social supports of drug use is interesting because now the police are taking on an additional role of being a social service and support worker, which can be mixed based on the interactions people have, right? Like not everyone's going to have a good interaction with the police. And think about it like this. If you are a drug user and a police officer, is harassing you, et cetera, do you remind your police officer in that moment to say, hey, by the way, you're supposed to provide me information on health and other social supports for my drug addiction? Like, I can't see that interaction happening. So I don't know if the authors of the policy in British Columbia have really thought through how this impacts policing, right? So that's something. Now, I kind of understand why BC has focused on drug decriminalization. Overdoses and poisonings in BC have increased 75% since the province first declared a public health emergency in 2016. In 2022, paramedics responded to more than 33,000 calls related to overdoses and poisonings. Now, I think the reason why the idea of decriminalization has been put forward is because criminalizing drugs have been met with just limited results, right? So like the idea that we can criminalize the drugs somehow means that people will not take drugs because of the criminalized nature of it hasn't manifested. We've seen more overdoses, more deaths, um, uh, and it's turned into a public health emergency. So criminalizing drugs doesn't seem to deter people from obtaining, using, and overdosing on drugs, and in some cases, sadly leading to death. So perhaps a lot of public policy experts are saying criminalizing really doesn't solve this issue. It's been criminal for too long, and we're seeing upticks in drug use. So decriminalization could also be paired with a couple other things. Access to safer supply of drugs, ones that aren't laced with fentanyl and other chemicals. Government is your drug dealer. And then also social supports, a whole host of programs to help people either get off drugs or seek social help and supports for their current drug addiction. Now, there's a couple issues with this line of thinking, right? Again, we just need to know there's enough evidence to show that that's the case, right? That decriminalization leads to safer supply, as well that there are enough social supports out there for people to access. Now, here's my honest opinion. If you're a drug addict, and I hate to use that in a pejorative term, I don't mean it that way, but if you are addicted to drugs, I don't know if the overwhelming majority will access social supports for their drug addiction, right? Like, there's a lot happening in that person's life. The idea of accessing social supports may not be top of mind, right? So but of course, many do, and they get clean, etc. I'm not denying that. I just don't know that is something that enters someone's mind when they're really in the throes of drug addiction. But the other thing to that is, I don't know if people will access safer supply of drugs for their drug habit, if that makes sense. So I think it's a bit different than cannabis, right? So we've legalized cannabis here in Canada since 2017, and there are many cannabis shops all over downtown Toronto, Vancouver, Montreal, other major cities. You can find it. Okay, so definitely there's that. And I think over time, people most likely will ditch their personal dealer and go to these cannabis shops just because it's so ubiquitous. But for like things like morphine, cocaine, heroin, I don't know if people will access the government's drugs for that. The reason I say that is because of the stigma associated with those drugs. You know, cannabis has a different stigma associated with it than heroin, cocaine, methamphetamines. I personally don't know if the majority of Canadians would be okay seeing shops pop up with get your cocaine here, get your methamphetamines here, get your ecstasy and not fentanyl, get your ecstasy and other opioids. I don't know. I don't know if the vast majority of us would be okay with that. We're generally okay with, cannabis and alcohol, but when it comes to harder drugs, that's a tougher pill to swallow, no pun intended, but it's harder for people to be okay with that because there's such a stigma on those drugs. And also those drugs are hard and they can lead to all types of health crises as well, personal health crises, and also the danger to society, right? People are on drugs and commit crime. That's a real consideration for people in urban centers. So the other thing to this is that BC's personal possession amount was, quote unquote, only 2.5 grams. There's actually a study done with heavy drug users called I Could Do That 2.5 grams. I could do that before noon, a qualitative study on the impacts of BC's decriminalization. And in this study, a lot of participants said the 2.5 gram threshold is really not a lot. There's a lot of people who, again, in the throes of drug addiction, 2.5 grams, they'll go through that very, very quickly. It also doesn't reflect that amount, 2.5 grams, doesn't reflect the diverse substance use profiles and purchasing patterns, especially for those that use a variety of different drugs, what's called polysubstance users. and those with higher drug tolerances. So again, if your addiction to drugs are very strong, 2.5 grams is not a lot. And as well, you could have multiple drugs on you at any moment. And I guess you would still be charged criminally once you exceed that 2.5 grams. So the other thing to this, and I've alluded to this at the beginning, is there's this dependency that when you interact with the police, it'll be like an information sharing, like a social support. I just don't see that happening. And the reason why is because, again, of the stigma with drug use, the potential for crime, the potential for breaking the law while on drugs being higher. Police naturally, by their job description, um, and their what they're tasked with, their first perspective isn't to share with you, hey, by the way, here are some like pamphlets on drug rehabilitation. Again, I'm not saying all police officers will be like that, but again, it's redefining the role of policing to be more like community-based police officers. And that I don't think, again, I don't know how that's going to impact policing in cities and societies writ large. And again, I don't know how many Canadians would be for that what's the word? Retelling or redefining of the police's role. So the police may be skeptical on one hand, but also the end user, the drug user, may also be skeptical that their interaction with the police will be positive. Chances are, if they're well known in the area or community, they may not have good interactions with police. And again, heavy drug users have indicated that decriminalization on paper sounds good, but in practice, this very well may not be the case. Now, I wanted to take a step back from all of this to say that, listen, I live in a major city here in Canada, and in the downtown cores, I could see a lot of people agreeing on some level with drug decriminalization for the benefit of, again, redefining what policing could be, as well as social supports, and again, a safer supply of drugs. Those are all kind of net good or positive things that I would say many would agree with. But you start venturing outside of the city to Greater Toronto area, Greater Vancouver area, the suburban areas surrounding the metropolis, and you're going to get a very different perspective. Faith-based organizations may have a very different perspective. They may say like no to decriminalization and yes to criminalization, and they may continue with that. And so here's the juxtaposition, or here's the crossroads, I would say, that Canada and other nations find themselves at. It's drug decriminalization has the potential for benefits. But before we can entertain a policy idea with throwing things at the wall and seeing what sticks, we first have to talk to Canadians to see if this is something they actually want. And my suspicion tells me is that in our urban centers, we're going to find pockets of people who really support this and they see the benefit. But outside of that, I don't know. I don't think that there's a lot of support for drug decriminalization, not only within our cities, but definitely outside our cities. I don't know if it'll be interesting to know from parents who have had their children who've been addicted to drugs, and sadly, those who have lost their children to drugs. I'd be interested to know their perspectives on drug decriminalization. I'd also be interested to know what Canadians truly think of cannabis legalization. It was legalized in 2017, and it's 2024 now, so it's been a good amount of time. I'd love to know what Canadians actually think, because my suspicion is that we've swept a lot of these topics under the rug because we're scared in some way to talk about the stigma, morality, the ethics behind drug use. And I feel like a lot of those voices are being left out in the pursuit of, let's say, what some would consider a progressive look at drug use and how we can address that. The last thing I'll say on this is what's being proposed by Dr. Moore and what is being tried in BC, in my opinion, what I've been able to see, needs to rest on sound research. Before top doctors can start talking about um, drug legalization or decriminalization, there needs to be enough evidence to show a few things. Again, safer supply of drugs, less hospitalizations and deaths, um, and greater social supports to get people off drugs. And I think, to be honest, if we don't see that concretely, I don't know if this will fly in Canada. And my worry is that policy professionals and not-for-profit groups will say, well, it wasn't implemented correctly, or there were certain environmental factors that played a role. I get that, but we have to be cognizant that there are many Canadians who are already 100% opposed to drug legalization and drug decriminalization. So in order to shift the policy framework towards these areas, a slow and steady and methodical approach needs to start happening. And maybe before top doctors start saying, hey, we should decriminalize, maybe there's a conversation that doctor needs to have with the chief of police to say, hey, why don't we start talking about first the role of the police officer in their interactions with those who are on drugs? Maybe that's a starting off point. I just think that if we go too soon, too fast, the outcomes aren't going to be the greatest as well. We're going to be distancing ourselves from those who totally disagree with government on these policies and say to themselves, I don't even see myself reflected in what the government's pursuing in their policy. But anyways, love to know your thoughts. Let me know below as well. I am excited to continue bringing you conversations, open minds, different topics, different perspectives, but I'm excited to share more with you. So let me know what you think in the comment section below.